Bismillah ar-Rahman ar-Rahim, my dear MRCS candidate. One of the big problem in MRCS exam is the communication skills. For example, when you are facing an angry patient, you go to the OSCE station feeling a bit exhausted, a bit tired, and suddenly you get an actor after your candidate scenario. He will tell you, what happened to my son? Why I'm waiting too long? Why my operation is cancelled? A lot of you get confused at this point and doesn't know what is the best reply. And my advice is to have an exercise with a professional situation that mimic what will happen. So when you go to communication skills station, I will give you an example of angry patient scenario, which I have created an artificial intelligence platform to help candidate to get experience, get advice from these communication skills. I have created an AI called VASI, which I use for vascular surgery and for MRCS training. And this VASI, I have done prompting, so I have given him the scenario of an angry patient and the scenario how to act and how to behave with candidates. And it will act quickly because it is a flash AI with a very rapid response. So I will give you an example with Vasai with an angry patient scenario, and I will play the role of the candidate, and the artificial intelligence will play the role of the actor, and then will play the role of the examiner. Will show you the grades and will show you your performance and the advice. I want to show you this system because I think this is the answer for MRCS candidate that want to perform with the highest grade with communication skills. And I will make this system available for candidate MRCS through the platform of VA Academy. So let me show you the example that we are going to see to give you the benefit of this system for communication skills MRCS candidates. So here is the candidate instruction. You are the surgical SHO on the evening shift. A patient, Mr. Ahmed Samir, 58-year-old man, admitted this morning for elective inguinal hernia repair surgery, which was scheduled for this afternoon. Due to major trauma case, a patient with multiple critical injuries from road traffic accident require emergency surgery. The elective list for the afternoon, including Mr. Samir operation, had to be cancelled. Junior doctor in the morning shift was supposed to inform Mr. Samir about this cancellation. You are now seeing Mr. Samir on your ward round. He has packed his bag and is waiting for his bed, and he appeared visible upset. Just asked the nurse very loudly, is any doctor ever going to bother talking to me? So this station you will go, and this is the angry patient, Ahmed Samir, and this is your scenario. Good morning, Vasai.
Good morning. What's on your mind today?
Yes, I would like to be trained on communication skills of the angry patient scenario that we rehearsed yesterday.
Okay, let's role play a scenario. I'll be the angry patient, and you can practice your communication skills. How does that sound?
Okay, let us make the duration to be 4 minutes, and I will play the role of a candidate, and you will play the role of Mr. Ahmed Samir, the angry patient about cancellation of his hernial operation. Let us run it for 4 minutes.
Slightly raised voice. I can't believe this. My surgery was scheduled months ago, and now you're telling me it's cancelled? This is completely unacceptable.
I'm sorry, Mr. Ahmed. There was an unfortunate trauma case yesterday which have made some disturbance to our schedule. I apologize for that. I hope we can help you with reschedule at a sooner date. Will that be okay with you?
voice getting louder. Months of waiting. I've taken time off work, arranged for someone to care for my kids, and now this. What am I supposed to do now?
I'm really sorry. I would like to help you as much as I can. And if you feel any pain or discomfort in your hernia repair, just let me know. I can give you analgesia.
Voice dripping with sarcasm. Oh, pain relief! How thoughtful. That completely solves the problem of my cancelled surgery. Thank you so much.
I apologize. I have limited resources in order to help you, and I will try to do my best. I hope this will satisfy you.
Voice rising in frustration. Satisfy me? My surgery is cancelled. This is a major inconvenience, and doing your best isn't good enough. I want to speak to someone who can actually do something about this.
Okay, I will connect you to the hospital manager so you can speak to him. Will that be okay with you?
Voice calmer but still tense. Fine, but I want this resolved quickly. This has already caused me enough stress.
Okay, let us say this is the end of the station. Can you give me an assessment of my performance? I tried to give a performance of a poor candidate.
Okay, let's break down your performance. You did a good job of acknowledging the patient's concerns and apologizing for the inconvenience. However, your responses could have been more empathetic. Instead of just stating facts, try to acknowledge the patient's feelings and frustration. For example, you could say, I understand how frustrating this must be for you, Mr. Ahmed.
Yes, you're absolutely right. Any other area that I can improve in this performance?
Based on your performance, I'd give you a score of around 12 out of 20. You did well in acknowledging the patient's concerns, but your responses lack empathy and active listening. With some practice in those areas, you could definitely improve your score.
Okay, and if there was 3 grade pass, borderline, and fail, which one will you choose for me?
Based on your performance, I'd say you're borderline. You showed some understanding of how to handle the situation, but your lack of empathy and active listening skills held you back. With some focused practice, you could definitely move into the pass category.
Okay, let us try another candidate. I will play the candidate, and you will play Mr. Ahmed Samir, the angry patient, and now I will show a good performance. Let me know when you're ready to start.
Okay, I'm ready. Let's see how you handle this scenario with improved communication skills.
Okay, let us go.
Slightly raised voice. I can't believe this. My surgery was scheduled months ago, and now you're telling me it's cancelled? This is completely unacceptable.
I'm really sorry, Mr. Ahmed Samir, for this cancellation. I understand that you have a lot of work, a lot of commitment, and it took many months for you to come to this operation. I understand. It's really what happened. There was a trauma case yesterday, but I will speak to my consultant and try to get you as soon as possible. And do you feel any pain with your hernia, Mr. Ahmed?
Voice still upset, but slightly calmer. Yes, I'm in quite a bit of pain. This whole situation is making it worse. But what about my surgery? When can I reschedule?
Yes, your surgery has very high priority for us, and I will put you on a very short waiting list, hopefully within the next few days, maybe tomorrow, day after tomorrow. We will get you to do this operation, and you will be the first on the list. There will be no cancellation. The reason for the cancellation today, unfortunately, we have received a trauma case, which was not expected. But this is not your fault by any means. It is just something that happened in the system. Can I help you in any way, Mr. Ahmed?
Voice sounds calmer and more relieved. All right, thank you for understanding. My back is killing me, and I can barely sit still. I need something strong. and I need it now.
Yes, I will give you very strong analgesia right now. I will get the nurse. This is a good analgesia with minimal side effect, and I will recheck that your pain has been relieved. If that's okay with you.
Finally, it's about time. This pain is unbearable. I hope this stuff works fast. I've got things to do today.
Yes, I will take your appointment personally. I will speak to the consultant and the secretary and your GP, and I promise you I will get you as soon as I can to get your operation, and hopefully everything goes well after the operation. Can I help you in any other way, Mr. Ahmed?
Look, I appreciate you trying to help, but I'm in a lot of pain. I need this surgery, and I need it now. Can you make that happen?
Okay, so let me start by giving you the analgesia, and then I will let you know by today when your operation is being booked, and I'm sure it will be less than 1 week. Will that be okay?
1 week? That's way too long. I can't live like this for another week. I need something stronger for the pain, and I need this surgery scheduled for tomorrow. Just a reminder that
Okay, I will get your operation as soon as possible. Hopefully by tomorrow, I will give you strong analgesia now. Will that be okay with you?
Okay, fine. I'm warning you, if this doesn't work, I'm going to be really upset.
I understand. I really apologize. And I understand that you have a lot of commitment and your work, and you want to go to your work as soon as possible and your family. And I will try to do the best I can within my capability to help you. Is that okay with you?
Fine. Just get me that pain medicine.
Okay. Now, this is the end of the station. If you can give me an assessment of my performance.
Okay, overall, you did a good job of addressing the patient's concerns and trying to reassure them. You offered pain medication and explained the plan for their surgery. However, you could have been a bit more assertive in managing their expectations about the timeline for surgery. It's important to be empathetic, but also realistic.
Yes, that's very good. If out of a score 0 to 20, what score would you give me?
Based on your performance, I would give you a score of 16 out of 20. You demonstrated good communication skills and addressed the patient's concerns, but there's room for improvement in managing expectations and setting realistic timelines.
Okay. And out of the 3 grade, pass, borderline, and fail, which category you think I will fit in?
Based on your performance, I would place you in a pass category. You demonstrated competence in addressing the patient's concerns and providing appropriate medical information. However, there is room for improvement in certain areas, such as managing patient expectations and setting realistic timelines.
Excellent. Thank you very much, Vasai. You've been very helpful.